Well, the Gem State is no exception to the countrywide opioid epidemic. In just the year 2022, 270 Idahoans died from an opioid-related drug overdose. We don't have the final numbers for 2023, that'd be last year, but they are expected to be at or near those levels, which is pretty high. Idaho made headlines last year as well for eliminating who was eligible for free Naloxone distribution, the medication used to stop a drug overdose. That change in law now has a new partner, hoping to get a solution to get the overdose reversing drug out to those who were left off that list. Joe Paris explains how the program works in 2024.
A 2023 law changed how Idaho could distribute Naloxone, the over-the-counter drug that reverses the deadly effects of an opioid overdose. The law made it so that federally funded Naloxone could only be distributed to Idaho law enforcement and medical agencies, and previously there was more room for the state to distribute it.
It's a life-saving medication when a person overdoses.
Ross Edmonds is the administrator for the Division of Behavioral Health at Idaho Health and Welfare. He explains, after a several-month pause on the Naloxone distribution program, it's now back with the new mechanism, a partnership with Kootenai County Fire and Rescue.
I think that was the big change, was making sure that we were partnering initially with those first responder organizations who can then make it available to other organizations and have that knowledge about how it works and how this first responder agency emergency response system works.
Yes, Kootenai County is up in North Idaho, but they are set to distribute Naloxone across the state to places that request it. Edmonds says the requests are already flowing in.
We partner with first responder organizations, with hotels, with bars, schools, healthcare organizations to distribute it broadly so we can hopefully get as much as we can out there and have it available.
It's not just about getting Naloxone into areas that could be life-saving.
It's also about the education that can go with it. So as to partner with first responder organizations and have them help us distribute it to the communities. There is online training and we want to make that available. The other thing we want to do is anytime you do that, you don't want this to become a cycle. You don't want a person to be constantly overdosing and have this be what they do. So we want to make sure we leave behind with them, here's the services that are available to you. Here's how to access those services. So hopefully we can prevent the next overdose.
To order, organizations complete an online request form through either the Division of Behavioral Health or the Division of Public Health's Drug Overdose Prevention site, right on their web pages. And if your organization would like training on how to administer Naloxone, Kootenai County Fire and Rescue will coordinate with your local public health district.
You can go to the pharmacy and get it yourself. But at the time of a crisis, to kind of say, when you're dealing with somebody who's overdosed, say, wait, I got to run down to the corner pharmacy, pay for it, come back. It's a little too late, so we want to make it as available as we can.
As captured in Idaho's drug overdose dashboard, this is a growing problem with the growing need for Naloxone. This drug makes a clear difference.
Hundreds of lives. Our data suggests that really we've saved hundreds of lives, thousands of lives if you look across the country. So a huge impact to this. Again, it's not a treatment, right? It's not a perfect solution. But we want to save people's lives so then they can get back to a place where they can get into treatment, get back with their families, get back to being a contributing member and successful in their lives.
And as you heard Edmonds just mentioned, again, Narcan is available over the counter. You don't need a prescription. You can just go to a pharmacy and buy it. But Brian, it really is part of this conversation of how do you take on the opioid epidemic while also having tools that are out there to save lives? Because I know that some people at home are probably saying, well, if you give Naloxone, if you have Narcan, which is the name brand, if you had it out there, people will just take it and know they can overdose safely and they can save their own life. Not how it works in practice. So It's a very interesting situation, but they will have Naloxone more available across Idaho now through this program.
But isn't every life valuable?
Yeah, it is.
That's what they say. All right, thanks, Joe.